This program and its contents are designed for information and educational purposes only. This program does not render medical advice or professional services and is not intended to be a substitute for professional care. The information provided here should not be used for the purposes of diagnosing or treating a medical or psychiatric condition. If you have or suspect you may have a health problem, consult your healthcare provider.
Hi, welcome to Positive Momentum TV. I'm Diane Silva, and today I have Bev and Carol from the Alzheimer's Association. They've been facilitating support groups for the Alzheimer's caregivers, and we're going to discuss Alzheimer's both from the patient perspective, or the person impacted by, impacted I guess is the best word. And then the next show, I think we're going to have enough material that we're going to go ahead and we're going to have a second show, and we're going to talk about the caregivers. So if you wouldn't mind, please settle in. And this is very educational, very important information to have, especially if you think or even suspect one of your loved ones has memory problems. And Carol and Bev, if you wouldn't mind, maybe introducing yourself a little bit and telling us how you got involved with the Alzheimer's Association and why you're still here. I mean, not that we love having you here, but what kept you here? You know, what kept you involved and engaged?
I'm Carol Stoltenberg. I got involved in the Alzheimer's Association when my mother was diagnosed with the disease back in the 90s, so it's been a long time. And my father and I went to a support group, in fact, the same one that I facilitate now. Wow. And I got so involved in the stories of the families then, so that when my mother did pass away, I continued to go and became one of the facilitators. And have discovered that it really is a family of people who get together to cope with this disease. All of the caregivers and so on, we bond and we get interested in each other's stories. And I've stayed involved simply because I want to be a part of their journey.
Oh, that's great. And Bev?
I'm Bev Thurkeldson. I started about 2005. My mother-in-law came down with the disease, and my husband and I moved in to take care of her, and found after about 6 months we no longer could do it. But for those first 6 months, we started attending an Alzheimer's support group, and I ended up at the same one that Carol is at, and I've been a part of it ever since. And again, the people, the journeys, their stories make it all worthwhile to be a part of it.
Understood. And I thank you guys, because that's how we got to know you. And my mother-in-law has Alzheimer's, and the support group has been a lifesaver. It's the camaraderie, and we will really get into that at the next segment. What I'd like to do today is kind of talk about, you know, what to look for, you know, what kind of symptoms, you know, we see in our loved ones that they're demonstrating, that maybe we want to get them some help. Because I know from my mother-in-law's perspective, I knew she had something wrong with her memory for years, and the family was quite resistant because it's frightening. You don't want your, you know, oh my gosh, my mother, she's my mother. Nothing can be wrong with her. And from Pat's perspective, she'd go to the doctor, and she'd be able to pull off the fact that she was just great. You know, she was fine. Doctor didn't know any better, but she'd drive around town, place she's been for 20, 30 years, and get lost. You know, so if you wouldn't mind, kind of come with some of the things you've seen and experienced, and we're briefly touching on a few other stories that I would love to get to before the show's, this segment of the show. So could you guys share some of your experiences, what you've seen with Alzheimer's patients, and maybe your mother-in-law?
Yeah, I would start by simply saying that Alzheimer's disease is a disease. It's not normal aging. We all go into a room or down to the basement or into the garage or whatever and forget what we went there for.
A lot.
Yeah. That's normal forgetfulness at the time because we have so much on our minds and we're so busy.
Right.
Alzheimer's disease is that. It's a disease that has physical symptoms. The brain's physical characteristics change.
Okay.
It is not normal aging or normal forgetfulness. And because of these physical changes in the brain, the most recent memories evaporate.
Okay.
And the person really goes through a reverse aging process. So the most recent things that they have learned are the first to be forgotten.
Okay.
And then it goes back and back and back. And all those things that have happened are simply gone. They can pull themselves together
Yes.
for those moments that you're talking about and fake it and ask questions instead of answering them. They'll respond with a question and do things like that. But in fact, those time frames are simply gone.
Right.
And I'm sure Bev has experienced and seen examples of that too.
Yes, there was a couple of things that crossed my mind when you were talking about that. And maybe I'm kind of backtracking even a little more, but when you see some things happening with your loved one, perhaps you just plain need to get a good physical and see what's going on. We're seeing more and more of younger onset, which you wouldn't even suspect to be an Alzheimer's situation. They can be in their 50s and sometimes even earlier than that. But we were talking earlier that sometimes dementia presents itself because a person has a hearing loss. And we don't think about that. They're not even hearing what you're saying and answering it appropriately. So maybe that's what they would call a temporary dementia situation. Urinary tract infections are huge problems for people that have any brain situation going. And all of a sudden you may see some bizarre, what you call bizarre behavior from your loved one, and if you got them into the doctor, you may find out that it's nothing but a urinary tract infection. So I think we need to make sure when you're suspecting something to go in and get a good diagnosis and have in most cases, a gerontologist take a look at your loved one and see what's happening and what direction you maybe other steps you need to take.
And one thing I would point out is really explain to the doctor that you are suspecting a form of dementia. And as Carol had mentioned, dementia is an umbrella, such as cancer is an umbrella. And you may have breast cancer or urinary tract cancer or bladder cancer. There's dementia, and then there's Alzheimer's form of dementia, or vascular dementia, or Lewy body dementia. There's many kinds of dementia. But let the doctor know that you are concerned about your loved one because they are showing signs of confusion or whatever, so they can actually investigate. As we said, the loved one can really, they've been dealing with this longer than we are realizing, so they've gotten really good at being able to hide it from anybody who has power to make changes in their lives, because they're fearful. I mean, I would be too. I might lose my memory, and I'm kind of freaking out going, oh my God, what are they going to do to me? And I know my mother-in-law came from a generation where nursing homes were not a good place to be.
Yes.
And oh my God, don't put me away, don't put me away, don't. And now, I mean, she loves where she is. The staff is fabulous. The environment is wonderful, and she's stabilized.
Yes.
Yes, and she has stimulation.
Yes.
I know we've often talked, I think it was a young nursing student that was with us one time that talked about thinking of the brain like a ball of yarn or rubber bands, and then they kind of keep slipping away.
Right.
But you can make some new memories, and they can get into a facility and add that routine to the picture,
Yes.
and add a new rubber band, and they know that this is time for lunch, breakfast, dinner, whatever, and this is time for an activity, and they get in a routine, and some of their functions are better.
Yeah, they don't restore them, but they do.
They
like you
can
said,
they can still make memories, and we need to
Right.
remember that.
Yes. And they need that attention. They need
Yes.
that stimulation. I mean, I remember when she was home alone, and I knew she had something going on, and she would tell me, for 3 days I wouldn't get out of my pajamas. I'm just depressed.
Yes.
I'm just whatever. I'm feeling so alone. And then when she was in assisted living, she was complaining, I want to go home. I want to go home. So we got to really be careful of what home means to start with, because she wanted to have her independence, but she didn't have her independence, and she wasn't in any better place when actually she was in a worse place when she was home alone than when she was in assisted living. But it wasn't comfortable, so we have to help with that transition.
So often that home for them is the home that they experienced when they were younger. And they're
Yes.
looking for that place where life has meaning and all the everyday events have meaning again. And so when they say they want to go home,
Yes.
my mother could be sitting in her own kitchen where she had lived for decades and talk about going home. And it was because that house wasn't making sense to her anymore,
Right.
even though she'd lived there for a long time. And that going home thing was not possible. But once we realized that she wasn't talking about that house, then we could deal with it.
I think it's more of a metaphoric home because, I mean, and I don't like to use the term metaphoric because it's a true home in their mind. We have to meet them where they are. And, you know.
Well, and in fact, that meet them where they are thing gets into one of our mantras in the support group, and that is, whether you call them little white lies or fiblets or whatever, you're not really lying to that. It was awfully hard for me to lie to
your
my
own
mother,
Yes.
because
Yes.
I was taught not to lie to her. But I had to say things that were not part of my world in order to get into her world.
And instead of looking at it as a lie, let's kind of look at it as everybody has their own version of reality. And that's every one of us.
Exactly.
And that is their reality at this moment. Like I said, I mean, I can give you an example. She had a situation where she ended up going to the emergency room. And she was taken by ambulance, and for 20 minutes she was, what date is it? Why am I here? I mean, repeating like it was, the record was unstuck for anybody of you who remember vinyl. You know, it's just, what time is it? The doctor walks in, he asks her
Groundhog
question.
Day.
Yes, Groundhog Day, but in a very faster, you know, and condensed version. But the doctor walks in, starts asking her questions. She is clear, concise, lucid, and answers these questions. He looks over at me, and I'm going,
Yeah.
you know, and I'm not, so, you know, he
They
wouldn't
know. They know, though, when they need to pull themselves together
Yes.
and make things look right. And they can do that. But then they're totally exhausted, and you may find them sleeping.
days.
Yes.
Yeah.
But for an hour or so, few minutes, it depends. But they can pull themselves together and look totally normal, whatever
At
that
least
might
at the
be.
early stages.
Yes.
When
Yeah.
they, you know, my
Correct.
mother-in-law is now in a moderate to severe stage. Because of where she is, I'm saying she's not severe because I have other people to gauge from. She still can carry on a conversation. It may loop, but to some degree she gets it. But when she's tired, it's over.
Yes.
You know,
Yes.
but she can't hold it together like she used to be able to. You know, she can't walk into a doctor's office and really, you know, be able to you know, I mean, you see a doctor for 10 minutes. You can pull it, most of us can pull it together for that. Well, she can't at this point. So I know she's gotten to, but, and I'm sorry, I'm kind of losing track. One of the tools, at least here in Nebraska, is there's a building, it's Home Instead is the building, but there's psychiatrists, I don't remember what the name of this place is, but there's great psychiatrists and psychologists, elder care. There's all these kinds of resources within this building. It's right behind UNMC. Oh, I wish I could remember the name of the place.
Well, yes, I can't. Is it the Home Instead offices on aging? There's
Yes, I think that's their building.
Dr. Potter is there, and a number of gerontologists,
Yes,
and
and
then they have psychologists,
and
where they can do all the testing.
And these people are fabulous, and they are respectful, and they will. I mean, I took my mother-in-law there, and they asked her specifically, "Is it okay she's here? May I ask you some questions? May she, you know, may I talk to her for a moment?" You know, and they were so respectful of her, and gave her the dignity she deserved. And you know, so please don't be afraid to get your loved ones in for a screening. You know, you may save your life and theirs. And the reason I'm saying that, we will get into the your life part on the second segment we do, because being a caretaker is rough. Like Carol said, this is a family disease. The person who has Alzheimer's, if anybody's watched the movie 50 First Dates, this is what you're living. And eventually they become 10-second Tom, and then they get to the point where you can't understand what they're saying. And the toll it takes on the immediate family
Is huge.
It's huge, you know, I mean.
And that's why it is important to get the help that you need as early as possible. And of course, the help is going to look different in the earlier stages than it
Yes.
will later
Right.
on. You might go through having someone coming into the home for a few hours a day to help, then progress to an adult daycare, which we do not call daycare necessarily with the person. That sounds
Yes.
like you're sending them to kindergarten again.
Right.
And again, that respecting the person yet is very, very important. But there are adult daycares, and then placing them in a home. And I need to tell the story then of
Please.
a cousin of mine who was in her early 80s at the time, I believe. And she was not thriving at home. She lived
Right.
with her daughter. She had roof over her head, somebody there to take care of her physical needs, have meals ready and so on for her. But she was gradually going downhill, and we knew it. And her dementia, she could cover really pretty well, but physically it was a huge problem.
Okay.
We finally placed her, and that was very tough for her daughter to do,
Right. It
for all
is.
of us, but that she'd shared a home with all of their lives. But put her in a home, we thought she might last 6 months, and she lived there for several years. And it was
Exactly.
that routine that she did learn, regular stimulation, other people to talk to, and so on, and it really made a life or death difference. So again, I would encourage people to take that very difficult step, but to place their loved one when they see that they're not thriving at home.
That same thing happened with my mother-in-law in her late 80s. It got to the point where we said she probably has 6 months left to live, and we thought that was it. We placed her in the nursing home, and they said, oh, she'll probably live a couple of years, and we just kind of looked at them astonished because
Right.
of what we were seeing. Like you said, 50 years in her own home, and she couldn't find the bathroom in this little 1,000-square-foot home. And we placed her, and she lived 3 years. But she had regular food. They watched her medicines. She took them at the appropriate time. All those things, and they got her involved in some activities, and it made a lot of difference. So
Exactly. And one of the things the psychiatrist I saw with her was stating that families wait way too long. Because one of the things we don't realize is it's best for them to be able to go in a residential environment
and
adjust while they still can remember a few things. Because otherwise you're putting them in a strange environment, and it takes them longer, and they don't recall, they don't have any memory, and it's hard to build that new memory when they don't make sense of the world around them. Like you said, your mother-in-law couldn't find a bathroom in a place she lived 50 years.
Yes.
So that tells me that she was, prior to when she was living there, her mental state, memory state was prior to 50 years before that.
correct, yeah.
So maybe she was in her youth. And that's another point I'd like to make is, I play cribbage with my mother-in-law, but part of the reason I do this, A, to keep her engaged, B, it keeps her off of the woes, and we don't dwell on the memories of the bad things, but I also can judge where she is mentally.
Yeah.
Because this is something she's played with her mother when she was growing up. So if she has struggling with the rules, I know she's this place. And different points in her life, she was able to play it different, better. And so if she doesn't know the rules, I know, okay, she's well beyond before. It's just paying attention to where they are and really getting. I can't stress enough. There's help for them, and there's help for you, and we will cover the help for you in a little bit. But get them into the doctor, get them into a gerontologist. There's several different programs around town, and anybody who has, there's everywhere, not just locally Omaha. Any city has some sort of program. Every state has something on aging. You can look up, Google aging in your state, and you're going to find things. If you're not sure, Alzheimer's has a 24-hour support line. They can give you resources.
We have an excellent Alzheimer's Association here in Omaha, and look them up, call them. You can get information from them. You can get referrals from them. all kinds of support from the Alzheimer's
Besides,
office.
find a wonderful support group to attend.
Yes.
And
Yes.
there are a
Yes.
lot of them in town at different times and different days of the week, so you should be able to find something that would fit into your schedule where you can go and talk with other people about the same kind of situation. And again, that probably goes into the caregiver.
Yeah.
But I noticed a couple of things you were talking about that you see with so many Alzheimer's patients. The stories are, they always say, or I don't know whether we said it yet on here, that if you know one person with Alzheimer's, you know one person.
Yes, that's true.
But yet, some of the things are so much the same, it's amazing. I will hear over and over again where they're concerned about stealing. That seems to
Oh,
be
yes.
a typical
Yes.
situation. Or infidelity is another big one. A lot of the things seem to be the same. The men like to keep their billfolds close by. They
Right.
like to have money because that's usually what they were used to doing. The women are attached to their pocketbooks,
Yes.
and they may carry them around. So even though every case is different, there are some things, and that's why the support groups are so good, because you could go in and you say, my loved one says I'm stealing their things all the time. I get it. Or they're going through cupboards. I know in the middle of the night, my mother-in-law would take everything out of all of her drawers and pile them on the bed. And we'd wake up at 2, 3 o'clock in the morning, and she said, I don't know who was here. Somebody did this.
Right.
But they do those kinds of things. They're searching for something, and they just can't find it. And anything that they can do to keep looking for that piece of the puzzle is
Yeah, and
what they're doing.
it's hard to find something you don't know what you're looking for.
Well, yes, they're
Yes.
Yes, you know, and they do, and another thing to please keep in mind is they do, again, talk about, they accuse us of stealing, and they really go after the person that they're closest to.
Yes.
They become combative.
Yes.
You know, they can be accusatory, they can be downright cruel, and we've gone through all those stages, you know, and it's
And at that point, you need to remember that is not your loved one. It's not your parent. It's not your spouse. That is a person who lived 50 or 60 years ago.
Well, they have to stay on task around other people because they're not sure if this other person is going to stay with them, stand behind them. But their loved one, there's somehow, even
That's
though they
right.
push him away in a lot of ways, they still know that that person is there for them regardless.
they're safe.
And yes, and it's a safe way, just like a child having a tantrum. That's kind of their way of showing that. Would you think of that?
Definitely.
Yeah, that's kind of when we're talking about going backwards, and they're just
Yeah.
acting like a child.
And even when they may not be able to put a name to
Yeah.
that caregiver who's helping them, they still know that there's some kind of a connection. The story that I painfully but like to tell about my mother once when she was in the nursing home, I usually visited her during the day, and at this particular time I was in the neighborhood earlier in the day, or later, excuse me, and went in. She was already in bed and lying on her stomach, and I reached over and touched her back and kind of rubbed it a little bit. And she said, "Oh, that feels so good. My daughter used to rub my back like that."
Oh, that just,
And it told me, she doesn't know who you are. I cried at that.
I
But
can
she
feel it.
knows that she had a loving daughter who used to rub her back.
Oh, you know, sorry, I get a little
Yeah.
verklempt because this does hit a very close nerve, you know, as you know, we discussed. We're experiencing this. I watched my husband go through some really rough moments with his mother, and although she's not my mother, she's as close as I'm going to get to
Sure.
one, you know, but I also see what it does to him. And I can only imagine, and as you can see, you know, sorry, I got a little
Yeah.
verklempt, you know, it's just, it's very touching, and it's sad, and it's depressing, and it's scary, and I can't begin to feel what it's like for her. And when she gets combative and attacking or, you know, becomes repetitive, I just have to say, you know, how would I feel if it was me? How would I want to be treated if it was me? You know, and
That's
it kind of
exact-
puts me back in center and saying, okay, you know, this is what we're going to do. I apologize, we need to wrap this one up, but we're going to be back with Bev and Carol in a little bit to talk, next show, to talk about the caregiver side and finish up any conversations, you know, and you never know what part of it we're going to hit, but Alzheimer's is, again, a family. It affects the whole family, and you can't segment it and compartmentalize it. So if you have any questions or comments, give us a call, contact us. I will put the Alzheimer's Association website on here, so people can contact the Alzheimer's Association should they need anything. Also, if you ever want to talk to Bev or Carol, go ahead and get a hold of me, or you can get a hold of the Alzheimer's and they'll be able to connect you with them. And you can watch this segment also on positivemomentumtv@gmail.com, which is a part of YouTube. It's also on Facebook. If you have any questions, give us drop us an email. You got a subject you want to talk about. I thought Alzheimer's was a great one for me, but maybe you have something else you'd like to have us bring experts on. So support@positivemomentum.net. And again, thank you, Bev, Carol. I look, that.
Yes,
I'm a little
yes.
in a emotional place right now, and I look forward to us discussing the caretaker side.
We'll do that.
Sounds good.
Thank you very much.
You're welcome.
I know we